Hello, everyone. Thank you for joining us today for the webinar with Dubai Future Accelerators and Dubai Health Authority. Today, we'll be running you through, giving you an insight about DFA, and of course, you'll get to hear from the future team members from the DHA about the challenges that they're proposing in this cohort. Okay, just one point before we go ahead and start. This webinar will be recorded and uploaded into our websites, our channels in YouTube, and our social media platforms, just for everyone to be aware of that. A quick overview on today's agenda. We will, of course, have the introduction to Dubai Future Accelerators. As I mentioned, we will talk you through the program format. And of course, we will do an introduction to the Dubai Health Authority, and they'll get to talk more about the challenges that they have posted for this cohort, and how, of course, we'll run you through how to apply for these challenges. And then we'll have the application deadlines. And of course, towards the end, we will have a Q&A session. So another point, so if you have any questions, please go ahead and submit them in the Q&A function at the end of the screen. We have disabled the chat function, so if you have any questions, just submit them in the Q&A tab. And of course, as I mentioned, we will go ahead and answer them towards the end of the session. Okay, we can go ahead and start. So Dubai Future Accelerators is one initiative under Dubai Future Foundation, as we like to call it. Dubai Future Foundation, it's like the umbrella with many different initiatives, and Dubai Future Accelerators is just one of them. And of course, Dubai Future Foundation is part of Dubai's government. Okay, this is a quote from His Highness Sheikh Mohammed bin Rashid Al Maktoum. So the quote says, the future belongs to those who can imagine it, design it, and execute it. And of course, Dubai Future Accelerators is built or focused on the design it part of the code. And what we basically are, or who we are, we're basically the platform that connects startups, scale-ups with innovative solutions from different parts of the world to government or private sector organizations here in Dubai. Of course, we're the platform that connects them to come together to solve or co-create solutions for predefined projects, or as we like to call it, challenges. And of course, we do that through programs. So for this cohort, the format of the program is it's basically split into two phases. We have phase one, which is completely virtual. It will go on for 3 weeks. And then the 4th week is basically the pitching week. Again, completely virtual. And the initial dates that we've put for phase one is the 1st of November to the 26th of November. And of course, phase two is more or less the proof of concept phase. And of course, phase two, it would go on for 6 weeks. We would invite the companies to Dubai to work together with DHA. And the initial dates that we've plugged in for phase two is the 17th of January, so next year. And then it would go on until the 25th of Feb. So I'll just quickly run you through the selection process. So basically, when you submit an application to the challenge that you see fit to your solution, basically we have 3 different stages. So you submit a written application, and then of course we go ahead and evaluate your application. If it passes, it will go to the second stage, which is the phone interview with a team member from the Dubai Future Accelerator. And of course, once we have that interview, it's basically a 15 minutes interview where we get to know you better. You get the chance to explain the solution that you're providing in depth with us or with any team member from the DFA. And of course, if it passes phase two, it will move on to the shortlisted phase. And the shortlisted phase, of course, the team from Dubai Health Authority, they'll go over the applications, and then they'll go ahead and decide who would move on to phase one. So who would be joining them in the program. And as I said, phase one of the program, it's basically 3 weeks of virtual programming, and then week 4 is the pitching week. So we will have up to 4 companies per challenge. Okay, for phase two, basically up to 2 companies per challenge will get invited to join us here in Dubai. Again, as I said, the selected companies will join us in Dubai. They'll work together with DHA on a proof of concept. And then, of course, if you got selected, if you passed phase one, you'll of course go to phase two. Phase two, again, 2 companies per challenge will be invited to Dubai. And then of course we will organize flights, visas, and accommodations for up to 2 full-time members from each selected company. And then of course, stage 8 is basically the preparation, where we would set another webinar just to make sure everyone is prepared to onboard and fly to Dubai. And then of course, phase 2 is the actual physical phase where we would have you in Dubai. This is just a bit more detail. So basically what happens in phase 1, again, you will get a chance to work hand in hand with the team from Dubai Health Authority, which you'll get to meet in a bit. You'll also get a chance to work hand in hand with the extended team from Dubai Health Authority. So a team of doctors, a team of specialists from their side, to clearly understand the challenges or the requirements that and the current processes as well from the entity itself. And you will also get a chance to showcase your solution. You also get to showcase your solution, as I said, and you would know if it's the right fit for that challenge or not. And as I said, this would be pitched at the end of phase 1. Okay, for phase 2, basically, as I mentioned, it's more or less a proof of concept phase here in Dubai, where you'll get a chance to test your solution. Again, if you got selected, you will work hand in hand with a team of specialists, doctors, so you'll get to test your solution here in Dubai, hand in hand with the team. And you'll also get to present your outcome to senior decision makers within Dubai Health Authority. And beyond that, we also, us like within DFA's team, we host different sessions. So for example, here I have a couple listed. So for example, local business culture, you will get more insight on the local business culture here in Dubai. You will get a chance to know more about setting up an office here in Dubai during the cohort or with post the cohort itself. You will also we have different workshops like IP and data protection in UAE. So you'll get more insight in different things. So we do that through workshops. And of course, these are just examples. But as we go, we host different workshops throughout the programs. Here on the right, we also focus on business development. So you'll be able, or you'll have access to the ecosystem, the Area 2071 ecosystem. Basically, Area 2071 is the bigger ecosystem where we have private entities, big corporations, government. So it's like the bigger ecosystem. Basically, DFA is a part of Area 2071. So you can imagine how big Area 2071 is as an ecosystem. So you also get access to that. Community events, of course, this is something that we have different events throughout the year. You will also have access to them. And if fit, we also do introduce you to investors. Okay, so this is just the benefits. I mentioned this earlier. So selected applicants for phase 2 will be invited for 6 weeks here in Dubai. And of course, given the obvious situation with COVID, that's why I did mention that the dates are not fully confirmed yet, because we still not know, it depends on the COVID situation, travel restrictions, will they be fully lifted? Will they come back? So we're still not fully sure on that. But of course, we'll keep everyone posted. Here on the right, we have the benefits. So we cover travel visas, accommodation for up to 2 full members from each selected company. And of course, we do not take any equity. My part comes to an end. And now I'll go ahead and introduce the team from Dubai Health Authority. We have Dr. Shada and Khulud. You guys can go ahead and unmute yourselves.
Hi, good afternoon, everyone. This is me, Khulud Al-Ali, and I am heading the future team at the Dubai Health Authority. And as Sheikha said, I have my colleague with me, Dr. Shada, who is joining me in this webinar.
Thank you, Dr. Shada and Khulud. I'll leave it now to you guys for the presentation.
Our main vision is the provision and improvement of healthcare delivery and throughout the Emirate of Dubai. The mission is transforming Dubai into a leading healthcare destination by fostering innovative and integrated care models and by enhancing community engagement.
mental
first
well-being.
challenge that we are focusing on mental well-being. This is the first time for DHA Future Accelerators team to focus on mental health, and we want to improve the access to mental health for the society in Dubai, especially that there are many people who are hesitant to go and seek mental health support. So we want to look at different technology on how can we improve the mental well-being of the society of Dubai.
Khalid, I think this slide is basically just to elaborate more on the first challenge, which is the mental well-being. Read out the point. So what if mental well-being services are as mainstream as physical well-being? We have another point as well. So what if there are ways to identify mental well-being hazards ahead of time? We also have another point. So what if we can redefine the citizens' perception of mental well-being through interactive approaches? So expected impact from this challenge is to have technologies, or basically what are we looking for? To have technologies that ensure ease of access to mental health care to achieve the vision of DHA, which is a healthier and a happier community. So Khalid, I'll just a continuation of the first one. So expectation from solution, a mobile application software, a solution that is validated by professional mental health expert or bodies, a solution that ensures all UAE data privacy laws are. We'll move to the next challenge, which is early and swift healthcare intervention. Go ahead, Khalid.
And this challenge is quite broad. And this challenge, we are looking for different companies, different technologies. We are not focusing on one area in healthcare. It can be from chronic disease management. It can be even through the improving or increasing the accuracy in medical procedures or operation, which is done in the hospital. So, and definitely we don't look we are not interested in apps. For this challenge, we are more interested in gadgets, or if I can say the medical devices.
Okay, so expected impact from this challenge, basically to have a wide range of technologies that can speed up delivery of healthcare services to achieve a vision again of DHA, which is a healthier, happier community. And as Khalud mentioned, with this challenge, it's quite broad. Like they want to see what's out there, preferably devices or something physical. And then of course, this is just a continuation. So what are we looking for? Device-based solutions, as I just mentioned. So preferably no apps, no software. This is another point as well. So I think no medication-based solutions. So this is something that we're avoiding. The device should be tested on a minimum of 100 patients. And of course, this is something most of people who are submitting an application would be familiar with the FDA and the CE certification. So the device or the hand or the physical gadget should be FDA or CE accredited, or in the process of obtaining approval. So if it is in the process of obtaining an approval, in the application, you just there's a question where you just submit or let us know how long is it within that process, just for us to have a better coverage on that. Okay, so now I'll leave it to my colleague Natasha to run you through the application process, or how to submit an application. Natasha?
All right, thank you so much, Sheikha. All right, everyone. So now that we already know what the program structure is like, how you can be selected, what the challenges are, I think the next step is how is it that you can apply for these challenges. I'll just go ahead and talk you through it. Let me just change the slide. All right, perfect. So we've just had a facelift to our challenge platform and how you would apply. So the most up-to-date way, the previous links are also all active, but the most up-to-date way and the most seamless way for you to create your profile and apply for a challenge is as follows. So head on over to dubaifuture.ae/programs, and it'll bring you to this page. If you scroll down on this page, you will be able to see all upcoming programs. So at the top of the page, you see all the featured programs. At the as you scroll down, you can see all active programs. Over here, as you can see the programs for RTA, etc. So basically, if you keep scrolling down, then you select the program that you are excited about applying for. So in the case that you are really excited about applying for the Early and Swift Healthcare Intervention Challenge hosted by DHA, you'd go ahead and click on that. When you click on it, when you scroll through this page, you'll see all the information relevant to this challenge. However, to apply, there's a link on the banner which says login or register to apply. When you click on that, it will take you to to your Future ID page. Now, Future ID, if you already have one, you can log in. So it's an email and password. If you don't have one, you can click on register and create your Future ID. So over here, what you'll do is type in your email address, type in a password, and just agree to the terms and conditions and click register. When you do that, you'll be asked to verify your account. You'll receive an email on the same email address that you've plugged in for your Future ID. Once you put in those, the code, you will then be able to activate your account. We recommend you do a two-factor authentication. And when you do, it'll talk you through how to build your profile. So the first step, of course, is to fill in your data. Then you can enjoy accessing all the challenges. So basically, you will click skip at this point, and you'll go through a phase in which you're asked to fill out different aspects of your data. So this is kind of what you're going to be building a profile. So, you know, things that we ask, first, the email and password are already confirmed, but first name, last name, update your photo, your birthday, your LinkedIn page, etc., etc. Over here, as you can see, the dark black ones have already been filled out. The ones that are not, which are in the shadow for now, they still need to be filled out. You can only start using your Future ID once you fill out your full profile. After you fill out your profile, you can scroll down on the page and you will see a link or a plus sign to add your organization. Now, you exist on the platform, but we also have challenges where companies can apply. So this is why it's very important to build your company on the platform. You will then click on this, and when you click on it, you can search your organization. So if it's a organization that already exists, it'll show up as a drop-down. If it does not exist, add your organization. So for example, I've tried adding Natasha's new company. I realized that it does not already exist. So I'm going to type the name and wait for the drop-down which says create Natasha's new company, and I'll click on that. That'll take me through the process of building my company profile. Once I'm ready, I can go ahead and apply for any of the challenges with my login and password that I've already finalized. The application form for these challenges is also quite, it's quite brief yet precise. So that would be how you would apply. There is no uploads required. It's all a fill-in application form, some multiple choice questions, etc. And you are able to save it at every stage. So yeah, that's all from my side when it comes to how is it that you can go ahead and apply.
Okay. Thank you, Natasha. So that brings us to the end of these slides. So now we'll go ahead and open the floor for questions. Again, I have Khulud and Shada here with me. I'll just put out the Q&A tab to have a view on the questions that we got. Okay, so I have one question here that is directed to the programming. So how long is the physical phase? Yeah, so how long is the physical phase in Dubai? And should I apply for the upcoming cohort. So for this question, for the physical part or phase 2, basically it's a 6-week period where you'd be joining us here in Dubai and yeah, working hand in hand with the DHA team. So next question.
Also, I think the second half of the question, if you should go ahead and apply for the program, yes, feel free to go ahead and apply for the program, regardless of your nationality or where in the world you're from. This program is a global program, and we welcome participants from all parts of the world.
All right. Just scrolling down the questions. So. Okay, so this is a question that is directed to DHA. What existing apps or technologies that are DHA already using? It's not quite clear, but I think in general, Dr. Khulud and Shada, any apps or technologies that DHA are using at the moment?
We have different apps, different technologies that we use in different areas. We have robotics, let's say, in the field of knee replacement operations. We have apps that we use for telemedicine. So we have lots of things in different areas.
Okay. Okay, so Natasha, this question is directed to us. So is a locally established company? Okay, I think basically what they meant is, do they need to set up locally to be able to be part of the program?
So to apply for the program, we have opened these challenges globally. So you do not need to have any kind of local presence to be able to apply. What is required, however, is that you have a company set up, be it any part of the world. Because the application form is set up from an organization perspective, so you do need to have a registered company to apply for the program. But it doesn't matter where your company is registered. It does not have to be registered in Dubai.
Right. I think this is almost similar to the previous question. Is the company registration required as a vendor on DHA's portal? I think it's more directed to DHA actually. Khulud, Shada, so basically, does the company need to be registered as a vendor on DHA's portal?
Not at the beginning. The stage of POC, proof of concept, it should not be registered. However, if they will have to supply for certain things, then at that time they have to do registration. But at the POC level, no, there is no need.
I have a question here from the, so this is a question that someone submitted before the webinar. So currently in DHA, is there a definition for mental well-being or the quality of life?
See, currently we don't have any apps or any kind of technology which is dedicated for mental well-being. We only have our mental health department, which is located in Rashid Hospital.
Okay. So there's not yet any like proper definition within DHA's.
No, but we have our mental health strategy that they are working. They can view it on the DHA website if they are interested.
Okay, I think we'll go ahead and share the link later on. Okay, so this is another question. For challenge 2, it says that no software is needed. Focus should be on device-based solutions. However, to make use of device-based solutions and leverage patent-generated data, you need software to apply AI and machine learning. Are you only looking for hardware or hardware plus supporting software?
You mean challenge number 2, which is for mental health? Yeah, we know that we need a software for it.
Actually, yeah, challenge 2 is the broad one, the more general one.
Okay, yeah, see, it depends. There are some things which require software. This is something we understand. But what we clearly said, we don't want any solution which is an application. An application as a standalone, this is not something we are interested in.
Okay. Another question here. So startups with ideas as basic as prototype allowed to apply. So I think they're saying if they're at idea stage or with basic prototypes, so stage 1 maybe, are they allowed to apply?
See, if it is at very early stage, it means they don't have any approval. And we clearly want products that have accreditations from FDA or CE.
Okay. Okay, I have another question here that was submitted before the webinar. So let's say for the challenge, the mental well-being challenge. So because we're looking into apps, will they be alone or are they partners within Dubai to develop the app? So I think the question basically means, will the application be a standalone or will it be supported by any existing applications that you guys have?
Can be either. I guess it can be something that's already established by the company, or it can be something that's supported by something within DHA already. It depends on the app and the needs of DHA. So it depends.
Okay, I have another question here. So have you considered using AI and predictive algorithm to measure a person's well-being? So basically, I think there's...
That's already something we've looked at many times.
Yeah. Going.
All right, there's a question here. Could you give a high-level overview of the application process after creating a future ID? Yes. So just to give you an outline, once you create your future ID and then you go into the application form, the first part of the application form focuses on your personal information, which it'll already pull from your future ID, and of course your company profile. For your company profile, your company might do a wide variety of things, but for us, it's really important to get your company profile of what is most relevant for this challenge. So for instance, you might be let's say a medical device company with, let's say, 4 or 5 different divisions, but you are looking to push this one certain division. So then you would kind of tailor your profile to that. Then it's about highlighting your proposed solution. So we're interested in understanding how is it that you're looking at solving the challenge, what is unique about your solution, if you've deployed the solution before, etc. So there are going to be some questions focused entirely on the proposed solution. After that, there's some, further clarification. For example, if any of, there might be some specific requirements for each application. So, for instance, the DHA team requires you to have FDA or CE approvals. So that would be a question, do you have those approvals, etc. And then, of course, in the end, you just wrap up your application form with the terms and conditions, etc., and then you can submit. So it's not a very long or very long process. It's just a very detailed process, and the questions are basically designed for us. For you to provide the specific information that we require to make a decision. So that's that. I hope that answers your question. It shouldn't take you more than 10 to 15 minutes if you have all the details together of your solution and your company. There are no uploads required, as I mentioned.
Right, we have another question here from Serik. So how do you pick your applicants? What are the criteria involved in the process? So basically, we went through it. So if I go back and slides here. So basically, let's say for challenge 1, these are the expected, like more or less the criteria, right? So for challenge 1, a mobile application or a software solution that is validated by professionals in mental health care or experts, a solution that ensures UAE data privacy laws are indicated. And for the process, so basically once you submit an application, it has 3 stages or 3 gates. So basically, someone will review, someone from the team would review the written application, and if it passed, it would move on to the second one. And for the second one, basically it's the interview with DFA, someone, so you'll get a 15-minute slot where you would set an interview call with someone from the team. And of course, if it passed, it would go on to the shortlisted list, which would be passed on to Dubai Health Authority. And Dubai Health Authority would go ahead and do the final decision based on these criteria.
Also, I think it's important to mention that we look at, of course, fit to challenge. We look at degree of innovation. We look at your team. So there are quite a few elements from our side that we take a look at. And for us as well, it's usually it's a very competitive process from our side and from the side of the entity, in this case, Dubai Health Authority. So with regards to the final decisions, they're always made on the basis of the best fit. So it's really just about ensuring that the solutions that we decide to move forward with are the best fit.
Right. So we have another question here. So what kind of partnership would be between the owners of the idea and DHA? Basically, as Khulud just mentioned, idea stage is not something we're looking at. So, but if you're talking about the solution itself that you're providing, so you'll be part of a program, and so you'll be working hand in hand with DHA. But again, if your solution is basically in an idea stage, this is something DHA is avoiding. Also, like early ideation stage, that's something they're not focusing at the moment. Okay.
I think there's an important question here from Russia. She says that on one side it says that it has to be an app or a software, on another it shouldn't be. I think Russia, what we're referring to are 2 different challenges. So for challenge 1, which is focused on mental well-being, the expectation from the solution is that it would either be a software or a mobile application. But for the second challenge, which is the one focused on the early intervention, for that DHA is only looking at medical devices, and if they have supporting software, that is fine, but it has to be a device first.
Okay, so I have another question here from Brian. So the program is asking for design. So the 6 weeks is expected to be a period of ideation. What is the determination of IP developed? So Brian, basically, phase 2, which is the 6 week, is where you would, it's a proof of concept phase. So you would go ahead and test. So if you applied for the second challenge and you have a device or a machine, you would go ahead and test that with the team of doctors or professionals that you'll be teaming up with within Dubai Health Authority. So it's not like an ideation phase, it's more like proof of concept. So you'll test the device, you'll test the solution, and so on. So it's not an ideation stage. What is the determination of IP developed? I think it depends. So Khulud and Shada, I don't know if this is something you can answer.
Sorry, what was the question?
So what is the determination of IP developed? So yeah, let's say a company got selected in phase 1 and passed phase 2. What is the determination of IP developed? I think who would own, in terms of IP, who would store the IP?
Sorry, I'm not understanding the question, to be honest.
I think it's I think the question basis was the fact that it would be a co-creation. Brian, it's more on the lines of testing your solution and showcasing it to the experts and doctors here in Dubai. So that's what the proof of concept stage is, that you have to showcase on and prove to local
something
experts.
existing.
After that, so an IP in that case, because there is no co-creation, I mean, would not be transferred. I mean, because at the end of the day, it's about exploring if we would be using your solution or not.
Okay, I have another question here. So how does DHA see the future of pharmacy in Dubai, given that DHA is interested in new tech? Is there an appetite for digital pharmacy?
Digital pharmacy in the sense of what? If they mean robotics, we already have robotics in our hospitals. So we are not looking for have more robotics, as like robots in the pharmacy section. And if it is anything to do with medicines, this is to be managed by the Ministry of Health, not DHA.
Right, and this is something as well I mentioned earlier. So something to avoid, or something that DHA are avoiding, is so solutions that are medical based. So nothing medical based. Okay.
It means medicine based.
Yeah.
Yeah. Because medicines are managed by Ministry of Health.
Okay, so I have another question here. Can a company that is registered in Dubai and has funded a startup also apply? Natasha, this is more directed to us.
Yes.
Yeah,
So
they have a well-established project. There is no problem.
Sorry, Natasha, you were muted. Go ahead.
yes, I mean, I guess all startups are, as long as you have an exciting solution that you can push forward, you know, you're more than welcome to apply. I mean, the question I think is along the lines that that you own a startup or you funded a startup. Yeah, so basically, you know, yes, so you can apply as long as you own the solution and you have the tech and the expertise that worked on the solution. Because if you are going to move on to the second phase, you will be working very closely with doctors and other stakeholders from DHA. So you need to have the full expertise of the solution.
Right. Another question here. I think this is directed to Khaloud. So does the product or service have to be authorized for sales in the UAE?
Authorized for sales, you mean that they have to be registered?
Yeah,
by,
so registered and approved.
No, it doesn't have to be registered for the proof of concept stage, but definitely if we do a proof of concept and it is successful, then they will have to move on to that stage with the ministry.
Yeah, it comes at a later stage. Then.
Yes.
Okay, so I have another question from Brian here. What approval is required for mental health well-being challenge? So is there a required pre-existing professional body approval or
no, as of now, we don't have anything like that, you know, because if it is mainly softwares or, you know, quite like applications that they would be using, there is no definitive CE or FDA approval required. However, the application or the product that they want to use, in case it was product, maybe it needs approval from the authorities. However, if it was application, I don't think this, as I said earlier, the company should be well established. The team who are working on the solution should have some background in mental health. You know, we just don't want a group of technicians who are developing the solution, but they don't have any background of mental health. So we want the team to be aware of mental health, to have sight of background about it as well.
So there's another question. It's more or less like a continuation to the previous one. So for the mental well-being challenge, because we're looking into software and applications, so just correct me if I'm wrong here, Khaloud, it doesn't need to be FDA approved if it's an app or an application or a software. Khulud? So just to
Sorry,
confirm that.
Sheikha,
So just to confirm that if it's an app or a software, this is focused on the mental well-being challenge because we're looking into apps and software.
Yeah.
So it's there's no need for FDA approval on that.
No, there's no need for that, but companies should put in mind that data should be stored locally in the UAE. Are not allowed to use outside cloud. So the data should be always stored in UAE. Because if it is application, maybe it will require some information at certain times. So they should put in mind that data storage should be done.
Okay. So there's another question here saying that, are you looking into solutions focused on COVID-19 or prototype product related to COVID-19? So is this something you're
We can still look at solutions for COVID-19 because it is becoming one of the medical health issues that we are facing. So if we can find any good solutions, why not? But as I said earlier, prototype at very early stage, no, we are not interested in that.
Okay. So I have a question here from Basil. Can we apply for this program for a device which is on the process of the Ministry of Health registration?
Yeah, it's fine.
Okay.
Also, there's also there's some questions here. So actually, I seem to have lost the question, but it was focused on the program, the kind of costs that would be covered. So so they're asking if there's a pilot conducted, will it be a paid pilot? And what are the range of costs that can be paid to startups? So just to let you know, from a programming perspective, we will be covering flights, visas, and accommodation for the companies that are selected. But from a pilot perspective, I think, Khulud, you can shed light on that.
Yeah, we are not paying anything to the companies at the pilot stage because they are coming to prove their technology. So we are not sponsoring this this part.
Great. There's also a question about if there's any support provided from us for setting up a company locally in Dubai. Yes, there is. So from our side, when you are part of a program, as Sheikha had mentioned, we talk you through a series of workshops and do a series of introductions to kind of give you access to all the opportunities that are here in Dubai, which include how to set up an office locally. We also have partnerships to be able to do that seamlessly.
I'm seeing a pattern of questions. So kind of group of students that worked under a registered company can apply. So basically, you need to be, because when you apply to the program, it would be under the company's name. So if you're asking if it's an individual application, it's not the case. So again, it will be under the company's name. It's not like an individual application. I said a pattern because there's another question, are students allowed to apply? So if you're, again, it's not an individual application, it's like it will be under the company's name. Just scrolling down here.
We have a question here. Can companies that do not conform to any of the challenges apply? Well, we're looking at very demand focused kind of innovation. So if in the case that you have a solution that does not fit any of the challenges, we cannot guarantee any success. What I would recommend instead is wait for challenges to be posted on the challenge platform. Basically, I talked you through the website, etc. Just keep a close eye on that. You can still make your future ID and keep a close eye on the challenges that are coming up. We do post challenges almost every month with different entities. And also the Dubai Future Accelerators program takes place twice annually. So you can definitely keep a close eye for challenges that you will be a good fit for.
Another question here, can a health tech startup that is 2 years old but already has a formed company in Dubai apply? So again, if you look at the criteria that are back in the presentation, I think I can just go ahead and go back in the slides. So if you have a device, let's say as long as it is tested on a minimum of 100 patients, and the device that you have is FDA and CE approved or in the process of obtaining approval, then yes, you can go ahead and apply. Again, yeah, so as long as you cover these points, then you can go ahead and submit an application. There's another question. So I think, Natasha, if you can help me on this one. Can you specify few important data laws? Sorry, I lost the question. Can you specify a few important data privacy laws as they are very vague
All right.
on
Definitely. So basically, with regards to any services that require cloud, as Khulud mentioned, the cloud needs to be based here in the UAE. If it requires any servers, it needs to be based here in the UAE. When it comes to privacy laws, we kind of just follow what it is followed in Europe. So basically, you can just kind of, I think it's like GDRP something. You can just follow that. But what's very important and is going to be a very important element is that when there is data being taken from an individual, it has to be stored in Dubai.
Okay, we have another question here. What happens after being selected in the final stage? So this completely depends on what happens while you're in the second phase, in the residence phase. So this is like, in general, the outcomes differentiate from company to company, from challenge to challenge, cohort to cohort. So what happens after the cohort, it's a conversation that you would have with DHA. So it depends really on what happens during the program or phase 2 to be specific. Like we get these questions a lot. So will I sign a contract with DHA after the cohort? Will I sign an MOU? Will I sign a contract for pilot and so on? So again, this completely depends on the conversations that you would be having with DHA throughout phase 1 and after the program itself. So yeah. Okay, Khulud, this is directed to you. Does the company have to be exclusively registered for mental health care or tech?
Not necessarily it should be registered at that, but as I said, if they had a solution that focus on mental health, definitely that they should have a team or the research team with them who have that background, so that they can be able to have a proper solution that can cater that area of mental health.
Another question. Yeah.
I see another question here, and I think then we can wrap up. It's ask about what stage should the company be at? Should it be a few months old and already earning, or can it be a fully functional but not yet tested in the market? All right, so it doesn't matter how experienced your company is, at least from the requirements of DHA. What it does matter is that have you received any approvals? Maybe you started your company beginning of the year, but you've already received approvals, which is great. And have you tested your device with at least a minimum of a data set of 100 people? This is for challenge 2. So just ensure that it doesn't matter how old or young your company is. What matters is that you have tested your solution and that you have the necessary approvals.
Okay, I think, Natasha, there's one last question and then we can wrap up because I think it's an important one. This is directed to Khulud. So are there any current mental health or well-being solutions provided for citizens of Dubai by DHA?
No, we only have, as I said, the mental health department. I'm sure there are solutions that they are working on, but still nothing is published.
Okay, I think last thing is, does the mental health challenge include youth? So I think what they're trying to say here is it focused or targeted into a specific group? So elderly people, young people, youth, or is it general?
No, it is general.
Okay. Right, I think we can go ahead and wrap up. I'm just going to the last slide here just before we end this call. So the application deadline is on the September 20th. So please go ahead if you feel like your solution is fit to any of the challenges, go ahead and visit our website and submit an application. So again, here I'm just leaving the screen that shows the deadline of the application, September 20th. And of course, if you have any questions either directed to us when it comes to programming or any technical questions that would be directed to DHA, feel free to drop us an email. You can see the email address here on the screen, and we will go ahead and pass it through if it's directed to DHA or to us. Right?
All right. Thank you so much, everyone.
Thank you so much, everyone, for joining us for this webinar. Thank you, Khulud and Shada, for joining us.
Thanks, Sheikh and Natasha, for organizing it. And thanks to you both for organizing it.
Thank you very much.
Thank you so much, Khulud, and thank you, everyone. Take care.
Bye-bye.